Studio, we welcome now from the Mississippi House of Representatives, Representative Missy McGee represents District 102, which incorporates Forest and Lamar counties down there in the Pine Belt. The hub city area serves as the chair of the House Medicaid Committee. Representative McGee, it's good to have you on the program. Thanks for coming in.
Thank you, Gerard. I appreciate you inviting me on today.
Absolutely. So I know it's been extremely busy in your world, especially with this, really, it's historic legislation. It's historic because I'll just say this, that this is something that's been considered quite a bit over the years, going back to when it was made available to the states, and that was in 2014. And since then, it's gotten much discussion, much deliberation, but really little to no action. So now we have action, big action. It passes overwhelmingly in the House.
It did. We had we felt like we had really strong support. The vote showed that yesterday. We had 98 yes votes. So we were super pleased about that, and knew that we had the Mississippi House was committed to advancing this. It was Speaker White's. He has said it is a priority, a top priority for him, and so I'm really grateful that he has authored the bill. He moved it through. We got it through committee earlier this week unanimously, and then yesterday on the floor, 98 members of the House voted yes, and not a single question was even asked. So
I was shocked at that.
I know. So we're very, very pleased, and we're looking forward to it making it over to the Senate, and hopefully it will be met with the same success over there. So very, very excited about it.
It's splitting hairs, I know, but I just want to clarify. We had, in our news department, 96.
Yes.
So what were we missing there?
I noticed that too. So I think we had 2 people who did not vote when the vote was called on, and then they went back and recorded a vote.
Okay.
So if you don't cast a vote, if you're out of the chamber or whatever, then you can come back in and just record a vote. So I noticed that changed too, and I think that must be the reason.
What was one of those Representative Felcher?
No, I think he's ill, actually.
That's right. That's what I heard. Because I know that in talking to him, he would have voted yes had he been present.
So yes, I was about to say, I think we had a couple of people out yesterday, and I think that actually, if they had been there, we might have hit 100.
Okay. And Representative Curry, I believe, recused herself. Is that right?
But I think she was one that went back and voted when I looked.
Okay.
So I think she makes up one of those votes that she was missed. She was, I guess, not in the chamber or something. Yesterday.
Well, it doesn't change the outcome, and even, I guess, the protection the bill has from a veto. Those 2 votes don't change it. Those weren't necessary, but we want to get it right.
We do. We're happy to have all the votes we can get. So 98 is great, and we're thrilled to receive such a strong showing.
So you made a rather impassioned speech when you presented the bill, and I heard lots of positive feedback on that, just to let you know.
Thank you.
And including from around the halls here, folks were tuned in and paying attention to it and thought you did a really good job of presenting what is, you and I both know, is an extremely complex subject. I mean, this is really difficult to get your head around.
Yes, Medicaid is complicated for sure. And, you said that this has been discussed for a while, but, not really at the Capitol. So it was really historic because I believe last week when we had a couple of hearings, of which you were a part of one of those, those were the first time, I believe, now look, this is just my 7th year, but from what I've heard, that was the first time that we've ever had Medicaid hearings at the Capitol.
Okay.
And so to have hearings and then to actually bring a bill out of committee and then to actually, and next day bring it out on the floor and have it pass is truly historic. And so I felt like that this moment was serious enough that I wanted to take a few extra minutes to, really emphasize the gravity of what we were looking at and how many Mississippians that this really means that will be helped, hardworking, low-income Mississippians that need health care, and we know that we are an unhealthy state. We are, number one in preventable deaths. We have the shortest life expectancy of any state. We're number one in maternal, infant, and fetal mortality. I mean, those are places that we don't want to be, And as the leaders of Mississippi, I think that we have a responsibility to try to make changes to address those things, and to continue just to say no, without some other suggestion or another idea of how to make things better. Well, that's just unacceptable. So I think we put forth a great bill yesterday, and while Medicaid is complicated, the bill really is not.
It's not. I've read it. I agree. Pretty straightforward.
Yeah, it really is. And so it was easy for folks to understand. And so again, it was a big day, and I'm looking forward to it making it further down the process now.
So I do want to clarify. I agree with you that this is not a subject that really got talked a lot about officially in the Capitol, but it got talked about unofficially in the Capitol.
You're right. Fair enough. Fair enough.
Right. So.
Yes.
But I agree. Right. There wasn't any debate or deliberation.
Yes,
right.
That's right. No debate. No. I mean, and true. Bills would be introduced every year, and they would never make it out of committee.
Yeah. So. Okay. So here we are. I think it makes sense to just go through it. I mean, I've done it several times on the program, but I think perhaps with you present, and I know that you are one of the authors of the bill, along with the Speaker of the House. It's again, it is straightforward. I like the way it was drafted. I do have a couple of questions about things that I was confused about to make sure that this was the intent, as written, at least as drafted, or not. But do you want to? Maybe it makes sense to go through the financial aspect of this, because that's the key part of it to me. I've explained the 5% incentive, if you will, on traditional Medicaid that is on the table for 2 years, that looks like would produce nearly $700 million over that 2-year period.
That's right.
Based on how large our traditional Medicaid program is. So we got that, and then we got an additional 4% premium tax on the managed care organizations. And according to the legislation, this new coverage group would be administered by the managed care organization, because we also have a fee-for-service component. That's right. And that's where it gets kind of, you start losing people. And I get it. I mean, really. But the bottom line is there are third parties who manage some of Mississippi's Medicaid. They're third-party private companies. We, the taxpayers, the state pays them premiums to manage that population, those enrollees. They handle all the claims, pay the providers, do all the enrollment and all that other stuff. They pay a tax like every other insurer does in the state of Mississippi. Correct. And at 3%, I believe, of premiums.
That's right.
This is an additional 4%.
Yes, it is.
And that calculate. By the way, that's on the traditional premiums that they're getting on traditional Medicaid plus expanded Medicaid. The 4% is. Is that right?
That's right.
So that amounts to about $150 million a year.
That is what we've been told. That is the figure that we've had some experts kind of running the numbers on that, and they're telling us that should bring in about $150 million a year, and that the state support for the expansion population is also about $150 million a year. Obviously, it's a 90-10 match. So federal government pays 90% of the expansion populations, picks up the tab for that. And the state picks up the other 10. And so we believe with the assessment on the Medicaid MCOs that will bring in about $150 million a year. And we believe that's about what it will cost to run the program on an annual basis. State share, state support.
So if it's $150 million a year, and we're going to get somewhere between 600, let's look at the low end, 600 to 700 million in the form of an incentive to expand that's tacked on to our existing traditional Medicaid, that means just the money we're getting from the federal government covers at least 4 years of the state's expense.
That's right. So the incentive on our traditional Medicaid, which we get an additional 5% on our FMAP, our match, it must be used on the traditional Medicaid program. However, we also have an assessment on hospitals that we use for that program right now. So we can use that on the expansion.
I got you. Bottom line is kind of fungible anyhow.
Yeah,
but,
it all works.
Yeah.
It does.
We got Representative Missy McGee in the Element Well studio. We're coming right back. Element Well studio, Representative Missy McGee, our guest from District 102, that's Forest and Lamar counties, the chair of the Mississippi House Medicaid Committee. So we were just talking about the economics of this, but there, when I testified last week, Representative McGee, I started out by saying, there's health and then there's health care. And there is an important distinction. And I think it's unfortunately accurate to say we have challenges with both here.
Sure.
In Mississippi. We have an unhealthy population. We know that. And we produce statistically overall the worst health outcomes. Our folks are just not as healthy as they should be. And there's a number of reasons for those outcomes. One of those is just lack of access to primary care, preventative medicine. The good news is we got a ton of that these days. We have, as a society, as an economy, we have created so much diagnostic, so many diagnostic tests and wellness tests and exams that can find things before they fester and grow to be a bigger problem. And often they're in your body and you don't know anything about it. I testified that last week. I'm one of those whose life was saved as a result of that.
That's right.
So we want people in our state to have access to primary care, to keep them out of the ERs, and to hopefully find these problems before they get to be way more serious so they can be treated fairly easily and inexpensively now in many cases.
Well, you're right. I mentioned that in my presentation of the bill yesterday. We are hoping that individuals will take responsibility of their health care if they have access to care. I mean, some people have poor access, some people have no access, but we're hoping that folks will find a primary care home where they can be treated for high blood pressure and diabetes and things such as that before it becomes a really big problem for them. And then, if they're they have a heart attack or stroke, then you're looking at somebody potentially not being able to work, not being a part of the workforce, and perhaps on disability. I mean, that's a terrible direction for that, for people to go. I mean, it's expensive for the state. It's not good for our population, and certainly those that are living in poverty. If you can't work, if you're not healthy, you can't work, and so we're hoping that folks will, be able to be treated for those kind of conditions. Also, you said, like screening for cancer, basic screenings like colonoscopies and mammograms, things such as that. Those are highly, highly curable forms of cancer if they are caught early
Right.
detection. How often do we hear that?
All the time.
But so many of our, so many Mississippians don't have access to that. And so we're hoping that this group that is 138% of the poverty level or below will have those opportunities to have the care they need to have a healthy life and to be a part of the workforce and take care of their families.
So one of the things that it gets brought up a lot by folks who are concerned and reluctant to take this on is that the federal government may alter its 90% contribution to the expansion coverage group, which is being relied upon in our budgeting and in our financial models. So tell the audience what happens to the Mississippi's program should the federal government reduce the federal match here of 90%.
So we included in the bill a provision that said if the FMAP, the 90% FMAP on this expansion population ever goes below 90%, that the program will cease and we will begin to disenroll these individuals that are on this part of our Medicaid program. But Gerard, you and I both know that that's not going to happen. The federal government is not going to drop below 90%. This program has been around for 10 years now, and even when we had a Republican president and Republican House and Senate, they did not reduce the FMAP on the expansion population. So we put that in there to make some folks feel comfortable. And but and I guess as a backstop, just in case.
Yeah.
But I've also heard that it is a very typical provision in other states' expansion bills as well.
Okay.
So I think you would find that in a bunch of, especially in a bunch of 1115 waivers that CMS has approved. But we don't anticipate that the federal government will ever drop below 90%.
They could change the traditional FMAP structure as well if they sought to just reduce the money going to the states. The federal government has a printing press. We don't have one of those in the state of Mississippi, of course.
We do not. We do not.
Little different. All right, so that's one of the provisions that protects against any sort of future wilting of the federal government from the state's expense share. And then we also have this provision, this work waiver provision. But that's a little different. We're requiring that, but by a certain date, and if it doesn't happen by a certain date, then the Division of Medicaid is still instructed to implement the program. Talk about that.
That's right. So so Section 1 of the bill, the first part of the bill is it directs the Division of Medicaid to seek a 1115 waiver from CMS, which includes a work requirement in there to provide coverage for this 19 ages 19 to 64 part of our population that goes up to 138% of the federal poverty level. So we're very hopeful that our Division of Medicaid will go up to D.C. and negotiate this quickly, and I really enjoyed what you were saying in the segment before I sat down, that you have a little optimism that maybe Mississippi's different. And Speaker White said the same thing in his remarks yesterday at the press conference, that I think there is a chance that CMS may say, we need this deep red state, and Mississippi is the poorest and one of the sickest. And our health metrics are not very good, and so they could really, really make a difference for us. And clearly, we have sent a bill with a strong majority of the House of Representatives, and I'm hoping the Senate will be the same. And maybe they'll take a look at it and say, we're going to grant this a work requirement. And we're counting on the Division of Medicaid to go up there and give it their best shot. You never know until you ask. Right. And I think everyone wanted a work requirement in the bill. The Republicans certainly felt more comfortable adding that work requirement to the bill, wanted to make sure that this is a bill for low-income workers. And so we added that to the bill. We're optimistic. Now, Section 2 of the bill says that if CMS does not approve the waiver, that by the end of September of this year, that these provisions will go into effect just in a state plan amendment, which is it will just become a part of our state Medicaid plan. That section cannot have a work requirement in it. So Section 2 of the bill does not have the work requirement. But Gerard, we know that this population is working. So I think all the studies I've seen, these people are working. Are there some people that might possibly get on that are not working, or they're not a full-time student, or they're not in some type of workforce training? Sure, certainly that's possible. But I would say to that, regardless of if we get the waiver or not, that we are seeking to help Mississippians, low-income working Mississippians, of which we believe the vast majority of this population will be working. And so to me, it's not worth not helping that population if we have a few people that we help as well, and maybe they're not working, maybe they can't work. I don't know, but I certainly would not want to hold this bill back or not be successful and have to wait for another year or another couple of years before we help the folks in Mississippi. And the goal is to help low-income working Mississippians. And if we get it in the 11 and 15 waiver with the work requirement, that helps them. If for some reason CMS does not approve that, then I believe Section 2 kicks in as a backup, and we still get the program.
But we should point out that it has a repealer in it in 4 years, right? So if there are those who have voted for this because of the work requirement and are optimistic about that, and this thing goes into effect and we implement the program without the work requirement, come back in 4 years, They could vote against it, saying, well, I didn't get a work requirement, and we would dismantle the program.
That's true. So we put a repealer in it. I mean, we've tried to put everything in this bill to make everybody feel comfortable. Anybody that was a little nervous about some of the provisions, we have tried to cover all those bases. So, yes, it has a 4-year repealer in it, which really means we have to do nothing. It repeals.
Right.
So
that's true. Right.
So you don't have
to vote to reapprove
yes,
it, essentially.
So we would have to, in 4 years, we would have to come back and renew the program.
Right.
If it's a disaster, which we do not believe it would be, but, let's just be the devil's advocate on this and say, cost too much, too many people are on, whatever the reason, our health metrics are not better, our outcomes are not better, then, and we're not satisfied with the program, it just simply will go away.
Okay. On the other side of the break, if you can hang around, I got a question about what I think may cause some people to fall through the cracks.
Okay.
And I'll ask you that on the other side of the break. It's Representative Missy McGee in the Element Well studio, visiting with Representative Missy McGee, talking about this Medicaid expansion bill, which did pass by an overwhelming margin in the Mississippi House of Representatives. It was championed by Representative McGee, presented by Representative McGee, and also authored by the Speaker of the House,
Correct.
Jason White. He's the primary author, along with you as well. So, and I will say this is a very complicated subject, as you know, but the bill's not. I mean, it's pretty easy to read, honestly. You don't have to have a doctor and a lawyer and an insurance person and a Medicaid person next to you. But usually that's what you got to have to talk about this subject here.
You're right. And I was grateful for that because I had to be able to understand it to present it. But it's interesting. It doesn't have to be that complicated. There are lots of ins and outs to Medicaid, and many people know way more than I do. But the bill, as it is written, was easy to explain. I think the members of the House understood it. And so I was pleased. I mean, I think people thought we were going to have some 140-page bill when it rolled out. When it hit the bill status on Monday, it was barely 24 pages.
Yeah.
So, and I think that's good because I think people who are interested need to be able to understand it. I'm not a lawyer. Sometimes I think that this job would be a lot easier if I was because of reading all these bills and things such as that. But I'm not a lawyer. Most people out there aren't. And so anybody can read this bill, I think,
Sure.
and understand
I agree.
What the intent is.
All right, question about the work requirements.
Okay.
And you may or may not know the answer, and that's fine at this point. But so do I, what from an eligibility perspective, let's say I'm not working whatsoever. Because that's who we're trying to get to here. We're trying to get people off the sidelines into the workforce. We're hoping that having access to some sort of insurance coverage would do that, would motivate them. We all know, we talk about it from the governor down to our low labor participation rate.
That's right.
It is a problem in our state. Our state could be much more prosperous if that weren't the case. So 47%, I think, is the latest that are on the sidelines, not working. All right, so I'm not working. And all of a sudden, I have this opportunity to get coverage, insurance coverage through Medicaid if I go to work 20 hours a week. So do I have to work for a certain period of time to qualify? How does that work? Is it kind of done in arrears? Okay, I'm going to work. I'm going to go ahead and sign up for Medicaid. And then over the next 6 months, I just decide working's not for me. How do we manage all that?
Well, the Division of Medicaid makes those determinations in eligibility, and so they have a way that they check the current Medicaid, on eligibility. So whatever the eligibility requirements for the group is, they set those regulations. They determine those.
It's income eligibility primarily now.
It is, but whether you're still working, whether you're not, if your income level has increased, obviously, if your income level increases, then you may be beyond.
That's the big one.
138%.
Yeah.
So, but they do that now.
They do.
So on the traditional Medicaid, take for example, pregnant women.
Yep.
So I believe the federal poverty level limit is 194% for pregnant
That's
women.
right.
And so, they check all that out, and we don't outline all those details in the bill. And we did have some questions just around the Capitol. Well, what if this? What if that? But we can't possibly put every single detail of how Medicaid will run this program in the code,
Agree.
And so we leave that flexibility to the division. They know how to run Medicaid, and so when they are doing their determinations and determining eligibility, that we leave it to them to figure out if that person is meeting the criteria and are eligible under the law.
Yeah, and the main thing I was looking for there is, do I have to go to work for a certain period of time to qualify?
The bill doesn't speak to that.
I didn't think so.
It says 20 hours.
Okay.
So that's part-time.
Yeah.
And, we've even thought about, rather than number of hours worked, perhaps we just need to show like a W-2 or something like that. I mean, that, and honestly, that may be an area that we could look at as this continues to kind of make it through the process. So I'm sure more work will be done. I think we have got a really strong bill, really good framework for how we would like the program to be set up. And as we continue in our conversation with the Senate, we may tweak a thing or two.
I got you. Before you go, I would just offer this suggestion, I guess.
Please.
Which is, let's make sure that Drew Snyder and his team have the resources they need to administer this thing.
Absolutely. For sure.
I know you guys have thought about that. I just want to add my 2 cents of emphasis to that.
I'm sure that Drew Snyder and that gang will appreciate that, and we will certainly do all we can to make that happen.
It's hard. Thanks.
It is hard. Thank you, Gerard.